This is Health and Lifestyle Show. A warm welcome from wherever you are. My name is Maria Mbo. Social media handles at KBC Channel 1 is where you can interact with us. Neglected tropical diseases, or NTDs, affect more than 1 billion people worldwide, mostly in low-income communities, Kenya included. These diseases like kalazaar, elephantiasis, trachoma are often overlooked but can cause lifelong disability, prevent children from going to school, and limit adults' ability to work. Despite their impact, NTDs are preventable and treatable, and global efforts are underway to eliminate them for good. All that's coming up in the Health and Lifestyle Show. First, a look at what's coming up.
Alienda hivyo kutokana na tumbo amekuja juu. Tumbo yake alikaa kama yule mtu kwa na mimba.
Quick action saves girls from a neglected tropical disease.
Globally, about 1.5 billion people are actually affected by NTDs.
Kenya makes progress in eliminating neglected tropical diseases, and on good practice, proper hygiene key to preventing NTDs. Enter our first segment now. Silent yet deadly. Kalazaar disease often goes unnoticed. Today, we take a closer look at what it is, how it spreads, and what can be done to stop it. Timely action can save lives. A grandmother watched helplessly, her grandchild struggling with an illness no one seemed to understand. What seemed like a small problem, swelling of the stomach, slowly affected school, play, and even confidence. In the following story, a grandmother shares the pain and fear of dealing with a neglected tropical disease, kalazaar. When Agnes Musana's granddaughter started showing signs of illness, she couldn't imagine how close she came to losing her.
Hii mgonjwa nilianza kujua wakati alianza kwenda shule. Huyu mtoto alikuwa grade 2. Tuko mbali kidogo na shule. Alitembea mpaka akashindwa kutembea. Akikuja lunch hawezi kula. Na akikula rai chakula iko na mafuta. Anakula mafuta, chakula kafu bila mafuta. Alienda hivyo kutokana na tumbo amekuja juu. Tumbo yake alikaa kama yule mtu kwa na mimba.
On World Neglected Diseases Day, she joined hundreds of locals and health experts to share her journey. Kajiado, a semi-arid region, distance, poverty, and limited access to healthcare often turns common illnesses into life-threatening conditions. Many families do not recognize the illness. Some believe it is witchcraft. Others turn to dangerous traditional practices.
Nandanu anasema mpaka anyoroshwa na mkono, wengine wanachoma na miba na moto, wengine wanakatakata hivyo, lakini hii ugonjwa ski.
She finally sought help at the Kajiado Referral Hospital. The diagnosis was kalazaar, a neglected tropical disease that kills silently if untreated.
Hii mtoto alikaa mpaka damu akaisha. Ndio alitusaidia mpaka tupate kwanza damu. Akawekwa damu, sasa kaanza sindano.
NTDs remain a major health problem. Community health promoters are vital in creating awareness.
In 4 counties where we work, just last year, we delivered, working with government and community health promoters, more than 6 million doses to 6 million people. And as a result of that, in those 4 counties, we saw the number of people with intestinal worms, because we test them, decline from 15% to 3%. That is falling from 5 out of 30 people to only 1 out of 30 people. You have seen the community health promoters here. They are actually the ones who deliver all those drugs, because a lot of them are given by the mouth. It's an amazing job they do, that working with community health workers, supporting them and elevating their work, because they are the pathway to that elimination agenda.
Kenya has eliminated guinea worm disease and sleeping sickness. It is now on the verge of eliminating elephantiasis.
Right now, the country has stopped transmission. So there are various stages. First, you have to identify the disease mapping. Is it there? If it is there, fine. How many? Where is it? 2. Then what do we do? Treatment and education of the community. You do that for 5 years for elephantiasis. The drugs, we bring them as WHO from our partners who have committed themselves, from the global partners like SI, GSK, Merck. They give us medicines at WHO. That is how we bring into the countries with no cost. But you have to take the medicine to the people with your money and your resources to make sure that they take those medicines and they control the infections. And when you have finished that, you monitor and they say, we have finished, it's not there, for another 3 years. Then we give you the certificate when you have submitted the report. It's called a dossier.
Today, Agnes' granddaughter is fully recovered. In regions like Kajiado, where sandflies thrive and awareness is low, kalazaar remains a hidden threat.
Huwezi jua utasuia aje kwa sababu hizi vitu wanasema naishi kwa hizi nini kinamea. Sasa na hizi vitu iko kila mahali. Sasa ujui mtoto ataenda saa ngapi huko, atatoka saa ngapi. Wamejaa, anajaa kwa boma yote. Sasa ujui, lakini dalili utaona mapema.
But early diagnosis saves lives.
Utafuta daktari wetu wa nyumbani, waeleze, naambia iko na hii shida, iko na hii shida, iko na hii shida. Ukipatikana, kwa sababu mpaka sasa wapime. Ukipatikana watakupeleka mpaka kwa hosi. Na hakuna pesa utalipa. Utatibiwa bure. Chakula utapewa bure. Na unalala huko na mtoto wako.
Indeed, quick action from the grandmother is what saved her life. Now, with early diagnosis and timely treatment, neglected tropical diseases can be successfully treated. Neglected tropical diseases may often go unnoticed, but they can have serious effects on health and daily life if left untreated. The good news is that many of these conditions can be prevented or treated with simple action. Here are some practical health tips to help you protect you and your family from NTDs on our good practice. Effective prevention measures include improving access to safe drinking water and proper sanitation and waste disposal, vector control by use of insecticide-treated bed nets, indoor residual spraying and elimination of mosquito breeding sites, mass drug administration to at-risk population helps reduce infection, transmission, and disease burden. Early diagnosis and treatment by strengthening health services, prompt and effective treatment to prevent complications. Animal and zoonotic diseases can be controlled by vaccination and treatment of animals, safe handling of livestock and animal products. Food safety measures include proper cooking of food, washing fruits and vegetables thoroughly. Improving living conditions means better housing infrastructure, which reduces overcrowding. Now, after the break, we hear from a doctor on what neglected tropical diseases are, their signs and possible complications. Stay with us. Welcome back to the program. Dr. Paul Kibati is an expert on NTDs. He explains what NTDs are, why they continue to affect the most vulnerable communities. Let's take a listen to this discussion.
Neglected tropical diseases are a group of about 21 diseases, which together affect the poorest of the poor in our society and in our communities. And these diseases range from parasites like schistosomiasis, transmitted helminths, elephantiasis, to fungi like mycetoma. We also have snakebite and venoming, which is really a non-communicable disease, but is also a neglected tropical disease. We also have viruses such as dengue and chikungunya. And so they are grouped together because they have common strategies that are used to implement programs for them, and also because they tend to affect similar demographics of populations, and globally about 1.5 billion people are actually affected by NTDs. And so that's why they were grouped together by the World Health Organization under one common umbrella, so they can be tackled together, and so that none is left behind.
Okay. So why name them neglected? Is there a reason as to why they are, put together, but in effect called neglected tropical diseases?
Unfortunately, it's because society tends to neglect the people who are affected by them. They find that it's the people who suffer the neglect more rather than the particular diseases. And so when the people are neglected, the diseases that affect them are left behind as well. So the whole that becomes a way of just bringing them together, just be able to bring advocacy. So all these people are able to be brought together and given timely interventions.
So Dr. let's just, straight on get into the nitty-gritty of what NTDs, are. Some of them, using local names, because I know we can be very scientific, which means some of the people watching might not really understand which diseases they are. But maybe you can just mention the local names that we know these NTDs with.
So schistosomiasis is known as bilharzia or kichocho. Soil transmitted helminths, commonly known as minyo. Lymphatic filariasis is commonly known as elephantiasis. In the coastal part of Kenya, they have other names, Shipa wa kushuka. Onchocerciasis is commonly known as river blindness, though we don't see cases in the country. Visceral leishmaniasis is known as kalazaar commonly. So those are some of the NTDs with the common names, and there are also other cultural specific names from different communities.
Okay.
Some kalazaar is called etid in among the Turkana people, and so forth and so forth. So different communities also have their own names for the diseases amongst themselves.
I know we also have sleeping sickness and guinea worm, which we'll be talking about in terms of how far Kenya has come in terms of just eradicating some of these diseases in the country. But paint for us a picture. How serious are these diseases in the country?
So about 15 to 16 million people are at risk of at least one NTD in the country. All counties in the country actually have at least one NTD. And the thing about NTDs is that they cause lifelong morbidity. So morbidity in terms of sickness that affects you for a long period of time. So some of the NTDs don't necessarily result in mortality immediately, but they result in long chronic manifestations. So like elephantiasis, when you have the swollen limbs, it means you cannot be able to do day-to-day activities, leading to a loss of economic status and a loss of potential income. Things like soil-transmitted helminths affect school-going children, which results in malnutrition, things like anemia, and so you find cognitive development for them to be able to participate well in school is not well done. Kalazaar, for example, which is fatal if not treated within 2 years, is one of the injuries that results also in a very chronic nature, resulting in people getting severe illness and they're unable to perform their day-to-day activities. So in common, you find that NTDs tend to affect your day-to-day activities and livelihoods, and the resultant loss of being able to sustain yourself now leads to continued cycles of poverty for these communities.
Okay, so let's talk about kalazaar, because that is one of the, can I say, stories that we were able to cover in this particular program. Having met the grandmother in Kajiado whose granddaughter had kalazaar. But in particular, there was an outbreak last year. I think it was in Marsabit, So what causes kalazaar and how does it present itself?
Yeah, so kalazaar is a parasitic disease, an NTD as well. And it's caused by the bite of a female sandfly. So an infected female sandfly will bite an individual, and now individuals with low immunity end up developing the disease. So not everybody who's exposed to the bite of a female sandfly will develop kalazaar. So most people will get infected with the parasite if bitten by the infected sandfly, but the body's natural immunity will fight against the parasite and clear it, and doesn't progress to the actual disease called kalazaar. However, in many arid and semi-arid areas where we are finding people with a low immunity, currently we're experiencing a drought in multiple parts of the country, with counties being on alarm and alert phase, severe malnutrition. So this leads to lower immunity, or some diseases like HIV and TB. So people who have lowered immunity end up now developing the disease because the body's natural immunity is not able to fight against the parasite. And as a result now, after infection, between 2 to 6 months, it's a chronic, slow manifestation with the body experiencing frequent fevers, leading to an eventual swelling of the abdomen, which we call splenomegaly, one of the organs of the body of swelling. And now this leads to many other complications in that people are frequently nose bleeding, there's loss of appetite, you end up with severe weight loss, and the body's ability to produce blood and blood products is reduced, leading people to be able to get common infections because they can fight them, and leads to things like now liver failure and eventually like kidney failure. So it results in a multi-organ function affecting multiple parts of the body. And so it's more of an immunological disease in the long run.
Yeah, you know, the fly apparently lives in the anthills, if I'm not wrong. That's what I was made to understand. But are there certain areas that are more prone to having, because I think I've seen anthills in various parts of the country, but seems like the northeastern, if I may put it, parts of the Maasai land is where we find kalazaar most prevalent. So is it the climatic conditions that make the disease, can I say, more deadlier in certain parts of the country, or?
Yeah, so we find kalazaar in arid areas in the country. Talking about counties like Baringo, Garissa, Yolo, Kajiado, Kitui, Wajir, Turkana, Port counties. So these arid to semi-arid areas in the country where you can find most of cases of kalazaar. Changing climatic conditions, the function geography, where these cases are being found, apart from just areas like where we find Ghana, Muscocot, and here, we're now finding cases in Samburu County, we're finding new cases in Tharaka-Nithi. Kajiado began reporting cases in the year 2021. So we cannot dispute the role of climatic changes and changes in land use, and how we are using our land for various economic activities. You find most of these communities are pastoralists, and so they have to move from area to area in search of pasture for their animals. And so in this frequent travel and movements, you find that people who don't have natural immunity move to areas where they find the disease is present, and so they introduce the parasite into the community, and so now people end up getting infected by the disease. And what we've been seeing in the country is that it mostly affects children under 14, with almost 70% of all cases being children under the age of 14 years old.
So there's been efforts to eradicate these diseases. Like you said, they're called neglected tropical diseases. But in essence, the people themselves are the ones who are neglected. It's a disease. These are diseases that are found mostly in areas with low sanitation, hygiene, and can I say poverty also is part and parcel of what actually, you know, pushes these kind of diseases. But Kenya has also made strides in terms of eradicating. I think there is a plan to eradicate, you know, some of these neglected diseases by 2030. So guinea worm and sleeping sickness are some of the diseases that Kenya has completely can I say, is it eradicated or eliminated? There are difference there. I think there's a difference between elimination and eradication. So you can explain to us the status of these diseases, and I know Kenya is also working towards, can I say, elimination of elephantiasis?
Yes, so there's a global push to eliminate a couple of neglected diseases by the year 2030. When we speak about Kenya, we've had great success in eliminating two of them. The first one being guinea worm, which was in the year 2018, and the second being human African trypanosomiasis, also known as sleeping sickness, in 2025. So these two have been eliminated as a public health problem. And so for eradication, it would mean that we'll have no cases of this disease in any country in the world. And the only disease that we've been able to do that is for smallpox. So Kenya has made great strides towards the elimination of other NTDs. So we're looking at the elimination of schistosomiasis, soil-transmitted helminths, lymphatic filariasis as public health problems before the year 2030. And so this normally is a mixture of what we call mass drug administration. And these three that I've spoken about, they are commonly called preventive chemotherapy, NTDs. That also includes trachoma and onchocerciasis, which is liver blindness. But in Kenya, we focus on four, which is schistosomiasis, bilharzia, soil-transmitted helminths, commonly known as minyoo, lymphatic filariasis, which is known as elephantiasis in some common terms, and trachoma. So these four are amenable to what we call their preventive chemotherapy NTDs, which is why the government, together with many partners, including AMREF, we've been supporting to do what we call mass drug. So these are areas where we're able to do a community diagnosis, where we find the prevalence of infection is above a certain point, and then be able to roll out mass treatment to affected communities. So for like trachoma, this is the infection rate of people of the bacteria in the eyelid. For elephantiasis, it's the parasite load in the blood. For certain elements, it's in the egg and worm burden below a certain level. But treatment alone is enough. We also institute of social behavior change and communication strategies, as well as water sanitation and hygiene. So it's a multidisciplinary, multi-collaborative effort, working with many other sectors, so that you can be able to sustain the gains. Once we have the reduction of prevalence or the number of people who are infected by this disease below a certain level, the aim is to keep it below that level for a period of time, so that now the country can be validated as having eliminated the disease. And so that is what we've been working to do. And great strides have been made, especially where the country no longer required mass treatment, where the disease was found to be endemic, which was in the coastal part of Kenya. So now it's just to ensure continued surveillance, ensuring that the prevalence remains below a certain level, and Kenya will be able to be eliminated by 2030, hopefully. For kalazaar, last week on Friday, during the World Neglected Tropical Disease Day, the Ministry of Health launched its elimination strategy. So this is a commitment by the government of Kenya to accelerate the elimination of kalazaar. Last year, of course, we had the highest outbreak ever recorded by the country. But countries, not only Kenya, but also in the region, about 9 African countries in the Eastern African region, have signed a memorandum of understanding that collectively they're going to put in efforts to eliminate the disease. So this involves a lot of cross-border collaboration, data sharing, and looking for common ways to tackle the disease across various aspects, from tackling the vector to treating cases from whichever country they come from, and just making sure that we're able to reduce the burden of this disease in the region by 2030.
Thank you so much, as always, for your time and your company. We've come to the end of the program today. Neglected tropical diseases. I hope you've gained some understanding of what they are and, of course, how to prevent them, because they are preventable and treatable. And so, on behalf of everyone who made this program possible, the production crew, the guests, we say thank you for your time and for interacting with us. My name is Maria Ambo, and I hope to see you again next time.